Tell us a little bit more about lean PCOS. It's something I personally have never heard about, but now I realize that I have noticed it. So please tell us about it.
So lean PCOS gets a little, like, I used to always find the lean PCOS frustrating to handle, because with someone who is an overweight PCOS, there's such a huge margin of correcting her weight and hence automatically not having to put her on, let's say, birth control or other medicines to bring her testosterone down. I could just say, hey, let's just use these drugs as a crutch for now. Let's help you lose weight and then we'll get off the meds. Now with lean PCOS, you can't really, you're stuck with, hey, we can correct all of your lifestyle and see how that goes, but you may still need meds because, they are young girls. And if someone's coming to me with acne and excessive facial hair, needs to like practically shave every few days, I can't tell her now you wait for 2 years for your lifestyle to kick in, because lifestyle does take time to roll in. Right?
Absolutely.
Yeah. So if you tell her now in the meantime you continue to shave, and because laser is also not going to work for her, it's very frustrating. So you have to hold her hand and say, hey, listen, let's use meds to slow it down, but you've got to do all of this. I typically do this, they're giving you this layer. In the meantime, you make this work, and then we'll take this off.
Correct.
But there has to be a longer term plan, because there's no cure for PCOS. It'll linger around and it'll impact everything. Your chances of getting diabetes when you're pregnant, your chances of getting diabetes in in the long run, your changes in cholesterol levels, your risk of endometrial cancer. A lot of things change just because you have PCOS. It's just not a disease of the ovaries. It's a syndrome that affects the whole body again. And then again, you come back to the same thing, right? The minute your hormones are off, it's affecting your whole body.
Yes.
It's not just restricted to getting pregnant or having a period.
So doctor, my question to you specifically then, as a final takeaway for PCOS is, even though it cannot go, as a chef and a nutritionist, I always view things in terms of nutrition and movement.
Yes.
How vital do you think this is in both cases, lean PCOS, regular PCOS, where a patient is obese? How important do you think nutrition and movement is? And do you think that it can reverse these symptoms or the conditions?
I think nutrition and movement and exercise is a non-negotiable for every human being. Whether you have PCOS, you don't have PCOS, wherever you are, whichever spectrum you are in, old, young, it doesn't matter, you need it. That should be a prescription on every pad. It should just be printed. And then comes, okay, you know what, despite doing everything, there will be that small section of girls who need that additional help. Don't shoo them away.
No, absolutely.
Yeah.
Yes.
Because I feel like those are the ones very often who get dismissed. Like, I have seen girls break down and cry because they're like, you're the only doctor who hasn't shooed me away saying just go lose weight and come back. But I'm trying, it's not working. Tell me what to do. So it is, I think that empathy needs to be there. And we need to understand that she is trying. And sometimes there is, even if you tell someone, doesn't everyone know that eating samosa is going to be a problem? Everyone knows it. There is a basic human implementation failure. And we have taste buds, sometimes.
And availability,
exactly.
My goodness.
There is the whole Swiggy and the this and the that. So the whole point is we have created this monster. Now we have to undo it. How, temptation is just, it surrounds us. And it's so hard for a 16-year-old to keep saying no.
Absolutely.
When we at our age still struggle.
Yes.
So definitely I feel like, starting from schools, I think some schools are a little more cognizant and are taking action. But I feel like we need to, I keep going back to grassroots, like how can we correct it? Because, you hear parents tell, what did you learn in school today? Eat green leafy vegetables. Okay, that's great, but we are going to eat pizza tonight. So where is the the harmony between what's being taught and what's being executed? And it's going to take a mind shift. We are not trusting lifestyle. We don't trust it to work. We don't trust the human body anymore. But it is a perfect system. Just look at how beautifully it functions when it is allowed to. And it still goes through the trauma that we put through it every day. It still shows up, and it still balances your sodium potassium chloride till you completely mess it up. So I feel like, coming back to your question, I feel like lifestyle is non-negotiable.
Thank you for that. Massive takeaway and something very important for all our audience to hear.
Absolutely, absolutely, any day. That's like the mantra.